Hello, I'm going to be doing a short presentation on climate change, health, poverty, and the role of RNs in facilitating change for better patient outcomes. So climate change, with its wide-ranging impacts on the environment, is intrinsically linked to human health and poverty. There was a lot of information that highlighted the significant risks of climate change, what climate change poses to health, especially for vulnerable populations. And they really emphasize the role nurses play in mitigating these risks and improving patient outcomes. By understanding that interconnectedness of climate change, health, and poverty, and by taking proactive measures, RNs can drive positive change and help to contribute to better patient outcomes. So some key highlights that I found while doing my research, really climate change exacerbates health inequalities. So these climate change factors such as extreme weather events, changing disease patterns, and food and water insecurity can disproportionately affect individuals and communities living in poverty. And these populations often lack the resources or infrastructure necessary to adapt or recover from health impacts of climate change. So these vulnerable populations, they face heightened risks. And those people living in poverty, including children, the elderly, racial and ethnic minorities, and those with pre-existing health conditions are particularly vulnerable to the health consequences of climate change. They may experience increased respiratory illnesses, heart-related illnesses, infectious diseases, and mental health issues. The intersection of health and poverty is a topic that I found as well, and climate change can perpetuate cycles of poverty by disrupting livelihoods, damaging infrastructure, and increasing healthcare costs. Poor health outcomes in turn hinder socioeconomic development and exacerbate poverty. The roles of RNs in facilitating change is really important. And as frontline healthcare workers, nurses have a unique opportunity to address the impacts of climate change on health and poverty by implementing targeted strategies and advocating for policy changes. Nurses can make a significant impact on patient outcomes. So some examples of nursing actions is really the first one would be education and awareness. So nurses can educate patients, families, and communities about the health risks associated with climate change, particularly among those vulnerable populations. And by promoting awareness and providing practical guidance, nurses empower individuals to take preventative measures and protect their health. They also can be an advocate for health equity, and nurses can advocate for policies and interventions that prioritize health equity and address those underlying social determinants of health, including poverty. This includes supporting the initiatives that improve access to healthcare, affordable housing, and nutritious food and clean water. They can also integrate climate considerations into patient assessments and care plans, which is really essential. RNs can recognize and address the specific health impacts of climate change on these individuals and develop appropriate interventions and ensure a continuity of care during climate-related emergencies. They can really develop, personal care plans for each individual person depending on their individual needs. They can also participate in research and evidence-based practice. Nurses can actively engage in research on the intersection of climate change, health, and poverty. By contributing to evidence-based knowledge, they can inform policy decisions, promote effective interventions, and drive innovation in the healthcare and the delivery of the healthcare. They can also perform in collaboration and community engagement. Nurses can collaborate with interdisciplinary teams, community organizations, and public health agencies to develop and implement strategies that build community resilience and promote sustainable healthcare practices. This includes advocating for climate-friendly policies within healthcare institutions and supporting initiatives that reduce waste, promote energy efficiency, and minimize environmental harm. By taking these actions, nurses can serve as agents of change in addressing the complex challenges posed by climate change, health disparities, and poverty. By leveraging their expertise, compassion, and influence, RNs can make tangible differences in promoting better patient outcomes, reducing health inequalities, and building more resilient communities. So in conclusion, climate change, health, and poverty are an interconnected issue that demands really urgent attention. As nurses, we do have a responsibility to raise awareness, advocate for change, and implement evidence-based interventions. And by embracing our role as change agents, we can really contribute to a healthier, more equitable future for our patients and communities.